Have you ever noticed how a single headline can make your chest feel tight before you even finish reading it? One of my patients once told me she slept poorly for days after hearing the words pandemic risk on the evening news. I want you to imagine something different for a moment. A quiet room, a calm conversation, and clear information that does not rush or alarm you. I am Dr. Evelyn Carter, and for many years I have sat across from older adults who felt uneasy not because something dangerous was happening, but because the language around health sounded frightening and unfamiliar. Words like pandemic risk can sound heavy, especially when sleep is lighter, breathing feels more noticeable, or anxiety arrives more easily than it used to. From real clinical experience, I can tell you that fear most often grows from uncertainty, not from immediate danger. Let me say this gently and clearly. The Nipah virus is very rare, and it is not part of everyday life here in the United States. Most seniors are not facing a direct or personal risk. When health experts talk about pandemic risk, they are not predicting what will happen next. They are studying possibilities carefully so systems can stay prepared. That kind of research is quiet, thoughtful, and ongoing, not urgent or alarming. The purpose of this video is not to warn you. It is to help you understand why experts are paying attention to Nipah virus, what they are actually watching for, and how calm understanding protects emotional and physical health far better than constant worry. This is meant to feel like a conversation with a trusted doctor who respects your pace, your dignity, and your life experience. If this kind of calm, respectful explanation is helpful to you, please take a moment to subscribe, like, and share Senior Health Daily. Your support allows us to continue creating steady, reassuring content made especially for older adults. For today, understanding is enough. You do not need to change your routines or stay on alert. In the next part, we will walk slowly through the science, the medical systems in place, and what all of this truly means for seniors, with clarity and peace of mind. What experts mean by pandemic risk. When health experts use the phrase pandemic risk, it can sound frightening, especially if you have lived through past public health crises or if your body feels more sensitive to stress than it once did. I want to slow this down and explain it the same way I would if we were sitting together in a quiet exam room. In medicine and public health, pandemic risk does not mean that something is about to happen. It does not mean a timeline has started or that danger is approaching your daily life. It is a research term. It describes how scientists evaluate whether a virus has certain biological features that deserve close study. These features might include how it behaves in animals, how it has acted in very rare human cases, or how it responds to environmental changes. None of this is a prediction. It is preparation. From my years working with older adults, I have seen how easily the word risk gets translated in the mind as certainty. A patient once told me that when she heard the word risk, her body reacted as if the event had already arrived. Her heart raced, her sleep suffered, and her appetite changed, even though nothing in her environment had actually changed. This is why clarity matters so much for senior health. When experts discuss pandemic risk related to Nipah virus, they are not marking a date on a calendar. They are asking careful scientific questions. Could this virus change over time? How has it behaved historically? What systems should quietly stay prepared? This kind of thinking happens far away from your home and your routine, inside research centers and public health offices designed to reduce harm, not announce it. It is also important to understand that rarity plays a powerful role in peace of mind. Nipah virus remains extremely rare, and it is not circulating in everyday life in the United States. Experts study rare events precisely so they stay rare. That work is one of the reasons most people never encounter these illnesses at all. For older adults, especially those managing chronic conditions or caring for loved ones, the most protective response is not heightened alertness. It is steady understanding. When you know that pandemic risk is a scientific lens rather than a personal warning, your nervous system can settle. Your body can stay in rhythm with familiar routines, which supports immunity, memory, and emotional balance. As we continue this conversation, keep this grounding thought with you. Experts studying risk does not mean you are at risk. It means systems are doing their job so you do not have to carry that burden yourself. Why Nipah virus gets expert attention. When experts talk about Nipah virus, it is natural to wonder why this particular virus is mentioned at all, especially when it feels so distant from daily life in the United States. I want to explain this gently, without alarm, and in a way that respects how older adults process health information. Nipah virus receives expert attention not because it is common, but because it is uncommon. In medicine, rarity does not mean insignificance. It means a condition is studied carefully so it stays rare. Over the years, Nipah virus has caused a small number of outbreaks in specific parts of the world. These events were limited and closely observed, but they taught scientists important lessons about how viruses can move between animals and humans. One reason experts pay attention is that in those rare outbreaks, Nipah virus has been associated with serious illness in some people. That information matters to researchers because it helps them understand how the virus behaves inside the body. It does not mean that most people who hear about Nipah virus are in danger. It means scientists take severe outcomes seriously, even when they happen infrequently. Another reason is the connection between animals and humans. Nipah virus is known to originate in certain animals, particularly fruit bats. These animals are part of healthy ecosystems, and they usually carry viruses without becoming ill themselves. From a scientific perspective, this makes them important to study. It helps researchers understand how nature balances viruses and why humans rarely come into contact with them in ways that cause illness. I often remind my patients that studying animal-to-human transmission is not about fear. It is about prevention. When doctors and scientists understand how a virus moves from animals to people, they can design safeguards that quietly protect communities. This includes food safety practices, agricultural guidelines, and early detection systems. These protections work in the background so individuals do not have to think about them every day. For older adults, this distinction is especially important. Expert attention does not mean personal responsibility. You are not expected to monitor global health patterns or change how you live. Public health systems exist precisely so you can focus on what truly supports your well-being: rest, routine, connection, and calm. In my clinical experience, understanding why something is studied often removes the emotional weight from it. Nipah virus gets attention because science is careful, not because danger is close. That care is one of the reasons most seniors will never encounter this virus at all. How Nipah virus has behaved in the past. To understand why experts talk about Nipah virus the way they do, it helps to look calmly at how it has behaved in the past. History gives context, and context reduces fear. When I share this with my patients, I focus on what actually happened rather than how headlines made it sound. Past Nipah virus outbreaks have been rare and highly localized. They occurred in specific regions, often linked to particular environmental and agricultural conditions. These were not widespread events that moved freely from place to place. They were contained within defined communities, and health officials were able to trace how exposure occurred. This matters because it shows that transmission required very specific circumstances, not casual daily contact. In those earlier outbreaks, public health teams acted quickly to identify sources of exposure and to protect surrounding communities. This included monitoring people who had direct contact with infected animals or contaminated food sources. The spread did not continue indefinitely. It slowed and stopped once those connections were understood and addressed. That pattern is important for peace of mind, especially for older adults who may hear the word outbreak and imagine something uncontrollable. Another key point is that these events were studied carefully after they ended. Scientists examined how the virus moved, who was affected, and what helped stop further illness. Those lessons are now built into modern public health systems. This means that if similar situations were ever to appear again, responses would be faster and more refined than they were years ago. From my experience in medicine, I have learned that people often feel more anxious when they believe a threat has no boundaries. The history of Nipah virus shows the opposite. It had boundaries. It followed identifiable patterns. It responded to intervention. That history is one of the reasons experts remain calm even while they stay attentive. It is also worth noting that Nipah virus has never established ongoing circulation in the United States. It has not become part of daily life here. This is not because of luck, but because of systems designed to prevent exactly that. Surveillance, travel screening, food safety practices, and communication between health agencies all play a role. For seniors, especially those managing health conditions or caring for others, the most reassuring takeaway is this. Past behavior shows control, not chaos. Nipah virus did not spread silently or endlessly. It appeared under specific conditions and was contained through careful action. When we understand how something has behaved before, our bodies relax. We can place the information where it belongs, as knowledge rather than threat. That sense of perspective supports emotional safety, which is just as important to health as any medical intervention. Probability versus possibility. One of the most important lessons I share with older adults is the difference between something that is possible and something that is probable. These two ideas sound similar, but they affect the body and the mind in very different ways. When this distinction is not clear, worry can grow even when real risk remains low. In medicine, possibility simply means that an event can occur under certain conditions. Probability means how likely that event is to occur in real life. Many things are possible, but very few are probable. A doctor may acknowledge a possibility in order to stay prepared, but that does not mean the outcome is expected or even likely. This is where confusion often begins, especially when health news is delivered quickly or without context. I remember a patient who once asked me if she should be afraid because she heard that something was possible. When we talked it through, she realized that her body had responded as if possibility meant inevitability. Her muscles tightened, her breathing became shallow, and her sleep was interrupted. Nothing in her health had changed. Only the interpretation had changed. This is why clarity matters so much for senior health. With Nipah virus, experts talk about possibility because that is how science works. Researchers explore what could happen under specific and often rare conditions. They do not assume those conditions are present in your daily life. Probability takes into account how often those conditions actually occur, where they occur, and who is exposed. When you look at probability, the picture becomes much calmer. For older adults living in the United States, the probability of encountering Nipah virus remains extremely low. It is not circulating in communities. It is not spreading quietly in daily settings. Those facts matter more than theoretical possibilities discussed in research papers or expert meetings. Understanding this difference protects emotional safety. When the brain no longer treats every mention of risk as an alarm, the nervous system can settle. The heart rate steadies, breathing deepens. This physical calm supports immune function, memory, and balance, all of which are essential as we age. I often tell my patients that medicine does not exist to make people anxious. It exists to reduce harm. When experts study possibilities, they are doing work so individuals do not have to. You are not expected to stay alert or interpret complex risk assessments on your own. As we continue this conversation, keep this grounding thought with you. Possibility invites study. Probability guides daily life. When you place each in its proper role, information becomes empowering rather than overwhelming. That sense of balance allows you to live fully, with confidence and peace, while trusting that medical systems are doing their quiet work in the background. Why seniors feel more alarmed by health news over the years? I have noticed a consistent pattern in my clinical work. Many older adults feel a deeper emotional response to health news than they did earlier in life. This is not a weakness. It is a natural change that comes with the body and brain aging together. As we grow older, sleep often becomes lighter and more easily disrupted. When sleep is fragile, the brain has a harder time filtering information calmly. A headline read late in the evening can linger through the night, replaying in the mind and making worries feel larger by morning. I have had many patients tell me that their concerns grow strongest at night, not because the information is more dangerous, but because the body is more tired and less resilient at that time. Anxiety also behaves differently with age. Earlier in life, stress might have felt sharp and brief. In later years, it can feel quieter but more persistent. Health news taps directly into concerns about independence, memory, and physical strength. When a story mentions illness or risk, the mind may quickly connect it to personal fears about decline or loss of control. This happens even when the information does not apply directly to the individual. Memory plays a role as well. Older adults carry a lifetime of experiences, including past epidemics, hospitalizations, or caregiving for loved ones. When new health news appears, the brain sometimes pulls forward those memories automatically. A word like pandemic may awaken emotional memories long before logical reasoning has a chance to respond. This is not overreaction. It is how memory protects us by trying to prepare us. In my practice, I have seen how quickly this combination of lighter sleep, heightened anxiety, and emotional memory can amplify fear. A patient may hear a single report and feel unsettled for days, even though nothing in their environment has changed. Their body reacts first, and understanding comes later, if at all. This is why calm explanation is so important for senior health. When information is delivered slowly and with context, the nervous system can stay regulated. The body does not enter a state of constant alert. This supports better sleep, steadier mood, and clearer thinking. I often remind my patients that feeling alarmed does not mean they are in danger. It means their body is asking for reassurance and clarity. When health information is paired with perspective, the brain can place it appropriately. News becomes knowledge rather than noise. As we continue, remember this. Your reaction to health news says more about how your body processes stress now than about the seriousness of the information itself. With understanding and patience, that reaction can soften, allowing you to stay grounded, rested, and emotionally safe while remaining informed. Staying informed without becoming overwhelmed. In today's world, information moves faster than the body can comfortably absorb, especially for older adults. I see this often in my practice. Many seniors are not overwhelmed because they lack information, but because they are surrounded by too much of it, arriving without context, without pacing, and without care for emotional health. Health news now comes from many directions at once. Television, phones, conversations, and headlines repeat the same words again and again. Even when the information is accurate, constant exposure can strain the nervous system. The brain stays in a state of alert, and the body responds as if it must stay ready for danger. Over time, this can lead to poor sleep, irritability, muscle tension, and a quiet sense of unease that does not easily lift. I often remind my patients that staying informed does not mean staying immersed. There is a difference between learning something once calmly and hearing it repeatedly in ways that increase anxiety. The aging brain benefits from rhythm and predictability. When information arrives in a steady and respectful way, it can be processed and then set aside. When it arrives constantly, it competes with rest, memory, and emotional balance. Another challenge is that not all information is meant for the same audience. Much of what is reported is designed for professionals, researchers, or policy discussions. When seniors hear these messages without translation, it can feel personal even when it is not. This is where confusion often turns into worry. Part of healthy aging is learning to choose where your information comes from. A reliable source should leave you feeling clearer, not more tense. It should help you understand what matters today and what does not require your attention. You are not responsible for monitoring global health trends hour by hour. That work belongs to systems designed to protect the public quietly and continuously. I want to pause here and speak to you directly. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. The goal of staying informed is not to carry every concern. It is to gain enough understanding to feel steady in your daily life. When information is delivered with compassion and pace, it supports dignity rather than disrupting it. As we move forward, remember that you are allowed to step back from noise. You are allowed to choose calm explanations over urgent headlines. This choice is not avoidance. It is wise self-care that protects your mind, your body, and your sense of peace. The role of public health systems. One of the most reassuring truths I share with older adults is this: you are not meant to carry the responsibility of monitoring health risks on your own. That role belongs to public health systems that work quietly and continuously, often far from public view. Public health systems exist so individuals can live their lives without constant vigilance. Teams of doctors, scientists, and health professionals track patterns, review data, and communicate across regions and countries. They look for changes over time, not single events. This work happens whether or not it appears in the news. Most of the time, it happens successfully and silently, which is why everyday life continues uninterrupted. From my clinical experience, I have seen how much relief patients feel when they understand this. Many seniors assume that staying safe means staying alert. In reality, safety comes from systems designed to notice problems early, long before individuals would ever be affected. These systems include disease surveillance, laboratory testing, food and agriculture monitoring, travel health protocols, and coordinated communication between hospitals and health agencies. When experts discuss viruses like Nipah, they are speaking within this system. They are not asking individuals to change behavior or remain on edge. They are ensuring that detection methods remain sharp and that response plans stay updated. This allows communities to remain protected without fear becoming part of daily life. For older adults, this separation of roles is especially important. Aging bodies respond best to predictability and emotional safety. When a senior feels responsible for interpreting health risks alone, anxiety rises and physical well-being often declines. Public health systems remove that burden. They are designed so you can focus on what truly matters: caring for your body, maintaining routines, and staying connected with others. I often tell caregivers the same thing. You are not failing if you do not follow every health update. Trusting systems is not ignorance. It is partnership. You care for daily needs and comfort. Health systems manage population-level risks. Each has a role, and neither needs to replace the other. Another quiet strength of public health systems is learning. Each past event informs future readiness. Lessons are carried forward, so responses improve over time. This means that even rare concerns are met with increasing experience and coordination. Understanding this allows the nervous system to rest. When you know that skilled professionals are watching patterns and trends, your body no longer needs to stay on alert. Breathing becomes easier, sleep improves, thought becomes clearer. As we continue, keep this reassurance close. You are supported by layers of care that exist precisely so you can live with steadiness and dignity. Your task is not to watch the world for danger, but to stay engaged with life, trusting that these systems are doing their quiet work on your behalf. Dementia, anxiety, and repeated health headlines. When memory changes enter the picture, the way health news is received can change dramatically. I have spent many years caring for patients with mild memory loss, dementia, and age-related cognitive changes, and I have seen how repeated health headlines can quietly increase distress without adding understanding. For someone with memory impairment, information does not always settle and fade the way it once did. A worrying headline heard in the morning may feel new again in the afternoon and alarming again at night. Even if reassurance was given earlier, the emotional imprint can return without the context that made it feel safe. This is not stubbornness or misunderstanding. It is how the brain processes information when memory pathways are altered. Anxiety often increases alongside memory changes. The brain senses uncertainty more quickly and has fewer tools to resolve it internally. A phrase like pandemic risk may trigger fear repeatedly, even if the person cannot recall why they feel uneasy. I have watched patients become restless, agitated, or withdrawn after hearing the same health story several times, even when the content was not directly relevant to their lives. Caregivers often ask me what they should do in these moments. The answer is not more explanation. It is calmer presence. Reassurance works best when it is brief, consistent, and emotionally grounded. Saying something like everything is being taken care of and you are safe today can be far more effective than repeating detailed facts. The goal is to protect emotional safety, not to ensure perfect understanding. Another important step is managing exposure. Leaving health news on in the background can unintentionally repeat distressing messages throughout the day. For individuals with memory loss, this repetition can feel like a series of new threats. Turning off constant news, choosing quieter programming, or setting specific times for updates can significantly reduce anxiety. I often encourage caregivers to anchor reassurance in routine. Familiar activities, meals at regular times, gentle movement, and predictable environments help the nervous system feel secure. When the body feels safe, the mind follows more easily. This approach supports dignity by meeting the person where they are, rather than expecting them to process information the way they once did. It is also important for caregivers to care for themselves. Witnessing repeated fear in a loved one can be exhausting and emotionally draining. Remember that anxiety in dementia is not a failure of care. It is a signal that the environment needs more calm, not more information. Understanding how dementia and anxiety interact with health headlines allows families to respond with patience rather than frustration. Calm repetition, steady presence, and reduced exposure protect not only emotional well-being, but also trust and connection. These are powerful forms of care, and they matter deeply as we continue aging together. What seniors should focus on instead. When health news feels heavy or repetitive, it can quietly pull attention away from the very things that keep the body and mind strong. In my years caring for older adults, I have learned that well-being is built less by monitoring distant risks and more by returning to daily practices that support stability and meaning. Routine is one of the most powerful tools we have as we age. Waking at a similar time each day, eating regular meals, and moving the body in gentle, familiar ways all send a message of safety to the nervous system. This steadiness helps regulate hormones, supports immune function, and improves balance and coordination. When routine is present, the body does not feel the need to stay on alert. Connection is just as important. Social contact does not have to be busy or exhausting to be effective. A phone call with a trusted friend, a short walk with a neighbor, or time spent with family can lower stress levels and improve mood. Research consistently shows that social connection supports cognitive health and reduces anxiety. From a clinical perspective, I have seen patients become calmer and more resilient simply by feeling less alone. Sleep deserves special attention. As we age, sleep patterns naturally change, but quality rest remains essential. Worry and constant information intake often interfere with sleep more than physical symptoms do. Creating a quiet evening routine, limiting exposure to distressing news before bedtime, and allowing the mind to settle gently can make a meaningful difference. Good sleep supports memory, emotional balance, and the body's ability to repair itself. Emotional care is another area where seniors can gently redirect focus. This includes allowing feelings to surface without judgment, practicing gratitude for what the body continues to do, and choosing activities that bring a sense of peace. For some, this might be reading, prayer, music, or time in nature. These moments are not distractions from health. They are part of health. I often tell my patients that awareness should feel supportive, not heavy. When attention is directed toward daily nourishment rather than distant concern, the body responds with greater ease. Muscles relax, breathing deepens, thoughts become clearer. For caregivers, this focus helps as well. Encouraging routine, connection, rest, And emotional safety creates an environment where loved ones can feel grounded, even when the world feels uncertain. As we continue this conversation, remember this simple truth. Your health is shaped every day by how you live, not by what you fear. By choosing steadiness, connection, and care, you are doing more for your well-being than any headline ever could. Confidence through understanding. As we come to the end of this core discussion, I want to leave you with a truth I have seen again and again in my years of caring for older adults. Understanding, when it is calm and grounded, does not shrink life. It expands it. When information is rushed or alarming, it can make the world feel smaller. People begin to avoid activities they enjoy. They hesitate to make plans. They pull inward, believing that safety comes from restriction, but the opposite is usually true. When understanding replaces fear, confidence returns, and life opens back up. I have watched patients transform simply by learning how to place information in the right context. Once they understand that experts are studying possibilities, not predicting personal outcomes, their posture changes, their breathing deepens, they speak about their days with more ease. This is not denial, it is perspective. For seniors, confidence is closely tied to dignity. Being able to say, "I understand what this means for me," allows you to remain engaged with the world on your own terms. It allows you to continue walking, visiting friends, caring for grandchildren, tending a garden, or enjoying a quiet morning without carrying unnecessary worry. Understanding also strengthens trust. Trust in your body, which has adapted and carried you through decades of change. Trust in medical systems that monitor risks quietly and professionally. Trust in your ability to respond if something truly needs attention. This layered trust removes the feeling that you must stay alert at all times. In my clinical experience, patients who feel informed but not alarmed make better decisions. They notice real changes without panic. They communicate clearly with their doctors. They sleep better and feel steadier emotionally. All of these support health in ways that fear never can. This is especially important for those who are caregivers. When you model calm understanding, the people you care for feel safer as well. Confidence is contagious. It travels through tone of voice, body language, and presence. A calm caregiver creates a calm environment, and that environment protects everyone within it. I want you to hear this clearly. Learning about health risks is not meant to place limits on your life. It is meant to give you enough clarity to live fully without carrying what does not belong to you. As you move forward, let understanding be something that supports your independence rather than challenging it. Stay curious, stay engaged, and stay connected. When knowledge is paired with compassion and patience, it becomes a source of strength. This is the heart of what we do at Senior Health Daily. We believe that clear understanding should help you step into each day with confidence, not caution. As we come to the end of our time together, I want to slow everything down and thank you for staying with me and truly listening. Taking the time to understand a topic like Nipah virus pandemic risk is not about preparing for fear. It is about finding balance. It is about knowing enough to feel steady without carrying worry that does not belong to you. If there is one message I hope stays with you, it is this. You do not need to change how you live. Your body responds best to steadiness, familiar routines, and a sense of emotional safety. The quiet rhythm of your daily life, your meals, your rest, your movement, and your connections already do far more for your health than constant vigilance ever could. I want to speak directly to those of you who are caregivers. Whether you are caring for a spouse, a parent, or someone living with memory changes, please remember that your calm presence matters deeply. Patience, gentle observation, and reassurance are powerful forms of protection. You do not need to have every answer. Being steady and kind is often enough. As you leave this video, know that you are not alone. Senior Health Daily is here as a quiet, reliable place you can return to whenever health news feels overwhelming or confusing. There is no rush to understand everything at once. Learning can unfold gently at your pace. Thank you for trusting me with your time today. Take a slow breath, return to your day, and carry with you the confidence that comes from calm understanding. I hope you will stay connected with Senior Health Daily and walk this journey of aging with patience, dignity, and peace.